I'm sure, like many people, you've listened to the news during the pandemic and thought, I wish I could do a little bit more to help. Well, one person who has stepped up is Viv Harrison from Wirral. She was a nurse for 42 years and retired 3 years ago. But when she saw just how many people needed help, she decided that she was going to go and rejoin the NHS. Well, Julia Bold spoke to Vivian earlier on during her break as she was busy on the flu jab programme for health staff. She started by telling us how her family were worried when she told them she was going back onto the front line amid COVID-19.
Initially, the first reaction from them was, oh, are you sure you want to do that? But they know what type of person I am and how dedicated I am, and have been for nursing throughout my life since I was 16, that they were fine about it. And I haven't looked back and they haven't.
So what did you go back to do then when you put the call in and said, I'm coming back? What job were you given?
The first job was just initially to support the walk-in centres, but that actually wasn't required because the public weren't attending, which was correct. So I was then asked to be part of a team to support hospital discharges into the care homes. So I worked in care homes for about 6 weeks. And then after that, I supported some telephone contacts to parents or carers for children that were on the continence waiting list. And then after that, which was sort of early June, I went to the COVID testing centre in Bidston in Birkenhead, and I helped coordinate and manage that until 2 weeks ago.
So you have been right in the thick of it, really. You've been working with some of our community's most vulnerable people. You mentioned the care homes there. We've seen, how dangerous it's been really for care home people recently. What was that like working with the care homes?
It was good. We were there to support them with the patients that were being admitted and ensured that we had full PPE, and we didn't have any concerns. We were there, obviously, hands-on, helping these patients with rehabilitation so that they could be discharged to home.
And as you said, you worked with sort of all ages throughout the pandemic, from
Yes.
children to care home residents, and then also the testing sites. It must have been quite emotional at times, though. I know you're fairly practical, but it must have sort of tugged at your heartstrings at times.
Yes, it did. And certainly when you're in the care home, when you're proper hands-on nursing with vulnerable elderly people, that definitely did. But we had lots of good times as well.
And what's your message to people at the moment then? Because, we're seeing the numbers going back up locally. What's your message to the Merseyside residents?
I think all we can do is what we're being asked for. Ensure you're social distancing, you're washing your hands, you're wearing masks when you're asked to wear a mask, and you stick to the, the household rules of people not going into other people's households. Like currently that's what our one of our rules are, isn't it? So I think you can only do what you're being asked to do.
Well, we all think you're an absolute superstar coming out of retirement to come back and help so many people. I mean, do you plan to put your feet back up again soon, or is this that you're going to stay with us for a bit longer nursing?
Well, my plan is, now I'm helping do the immunise the staff with the flu vaccines, I'll do another possibly 3 or 4 weeks. But my good news is I'm expecting my first grandchild early December. So I plan to go back into retirement and support my daughter and husband and the family with that. Because I'm a midwife and a health visitor as well. So I've got quite a lot of skills there.
You're a well-qualified grandma then.
Yes.
Oh, well, we wish you all the luck with that, and that will be absolutely fantastic. A baby for Christmas for you as well.
Oh, yes. Yeah, it'll be lovely. Thank you.